Dr. McGowan here. We're going to demonstrate a Spatz balloon implantation today. This is the actual balloon, what it looks like. It's a silicone balloon filled with saline, which we dye with methylene blue. And it has this flexible, floppy catheter that attaches to it, and that allows us to later on either remove fluid for someone who's having a hard time adjusting to it, or add fluid for someone who's maybe plateaued in their weight loss after 3 or 4 months. So this is an 8-month balloon. It stays in for 8 months, and then we take it out. So we're going to show the process of actually placing this balloon in the stomach from start to finish. So we'll get started now. So first step with this procedure is to do a basic diagnostic endoscopy. And our patient today was interested in non-surgical weight loss. She really wanted a reversible option just to help her get 20, 30, 40 pounds off, change her habits, and then have the balloon removed. So she didn't want anything permanent altered with her stomach. And so we're starting with a basic endoscopy. I'm looking for any sign of a hiatal hernia, which it does not appear she has in forward view. We're down in the stomach here. I'll flip around and take a look at the scope coming out of the esophagus, and she does not have a hiatal hernia. And we'll take a look down at the rest of the stomach and also dive down into the small intestine, making sure there's no ulceration or anything else that would interfere with our ability to place this balloon. And she has a nice, healthy small intestine and stomach. So at this point, I'll pull the scope out, and you'll see this whole procedure takes about 5 minutes. Our patient's under general anesthesia. That's our preference. This can be done under conscious sedation. We find the patient's more comfortable under general anesthesia, and it's a little bit safer, we think. There's just a lot going on in the airway, which you'll see. So I'm going to hand this to Victor. At this point, what we need to do is attach the balloon to the scope. So we utilize this device, which is the facilitator. And it's a pretty simple device. It's just going to wrap onto the scope. So I kind of slide it down with my thumbs. So it's on the tip of the scope. And we'll just check the orientation of the scope here. Okay. This is our balloon. So I'm going to attach this to the side of the scope using the facilitator. It just rolls over the balloon. And the reason we're doing this is because this balloon's kind of floppy, and we need to use the scope to pass it into the stomach. So that is on the tip. You can see 2 holes here. We're going to place the first over the scope and then the second. So the bottom one, then the top one, just kind of slide that down, and then we can lubricate this, and then we'll be ready to pass it into the stomach. So we'll connect this end to our extension tubing. So this end goes to our IV tubing. So we'll secure that and then snug this valve hold against our tubing. So this is ready to go. And this tubing runs to our IV fluid bag. All right, so our balloon is connected to the scope, and now we're just going to drive it down into the stomach gently. And you can see the balloon, it's fairly large, so again, there's just kind of a lot going on in the mouth and throat, so we like our patient intubated. But we are going to just gently pass this down the esophagus and into the stomach. And just making my way down the esophagus. We can't see the balloon because it's connected to the scope kind of behind where the camera is located. But I'm going to flip around and look backwards and make sure the balloon has entered the stomach completely, which it has. And then I'll actually drive down a little further into the bottom of the stomach. And now we're in a good position to fill the balloon. So we won't be able to see the balloon filling because it is behind us in the camera view. But we're going to start by filling the balloon with a syringe. So Victor can go ahead and push the first 50 cc's of fluid. And he's just making sure this fills easily without any resistance, which it is. For this patient, we are going to use a total of 500 milliliters of fluid. That's based on her height primarily, and whether she has any acid reflux or not. That's how we determine the size of the balloon. So the first 50 is in. For the remainder, we're actually going to use an infiltration pump, which we have set up here, and I'm just using a foot pedal, and I'm going to put the remainder of the 500 milliliters into the balloon. So on the camera view, again, we can't really see the balloon, but as it's filling, if I kind of tip the scope up, you can start to see it expanding. So that is our balloon filling up. And so the range of initial fill volume with the Spatz balloon is around between 400 and up to 550 milliliters. For someone who desires that up adjustment after 3-4 months, we can increase the size of the balloon to as much as 850 milliliters. And the goal there, again, is to maybe create a little more sense of fullness along the way before reaching the 8-month mark. This patient, as with all of our balloon patients, will work with our nutrition team and our dietitians and meet monthly or more just to make sure they're making the necessary dietary changes along the way, the necessary lifestyle changes, so that once the balloon is removed, this can be a long-lasting process and they can keep the weight off. So we're nearly finished here, and we can see approaching 500 milliliters. And there we go. So at this point, I can actually back the scope up, and the balloon will detach from the scope. And there's our balloon. So I'm backing the scope up, and I will hand this off. I'm actually going to remove that facilitator from the tip of the scope and hand the scope off. Okay, so the next step is attaching the cap to the balloon. So there's a little end cap that will just seal this off. So I'm actually going to grab the extension tubing and just gently pull it out of the mouth. It just works its way up the esophagus, and I can grab a hold of that, detach the extension tubing, which we don't need anymore, and then I will take the end cap and attach that to the fill catheter. We like to use a paper towel just to really make sure that's snug so we can have some grip. All right, and then I can use the little loop on the end to just release that back into the mouth. And then we'll finish this up. I'm just going to drive the scope down and just kind of gently push that catheter down into the stomach. So you can see this is the cap, and there's a wire loop attached to it. So later on, if we need to downsize or upsize the balloon, we can actually go down endoscopically, grab that little loop and pull it back out of the mouth, connect a syringe, and either remove or add fluid. So I'm just going to gently push this down the esophagus. And there we go. So the balloon and fill catheter is completely in the stomach. We can take a look at this in reverse view, and that's our balloon. So that concludes the procedure. Our patient will go home in about 30 minutes or so. She'll be able to go home, and then she'll follow a liquid diet for the next 3 days, then a clear liquid diet for the first 3 days. Then she'll advance to full liquids, which is protein shakes, and we'll slowly advance her diet towards solid food over the coming weeks. And then in 8 months, we can remove the balloon. All right, so that is a Spatz balloon implantation. Thanks for joining us today.